Good morning, everybody. I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. Today's topic is about cancer clinical trials. These clinical trials offer patients an avenue for cutting edge medical treatments and a chance to contribute to advancing scientific knowledge. Yet the decision to become a participant in a clinical trial is complex and nuanced, requiring careful consideration of several factors. These include the stage of the disease, your treatment history, and the nature and makeup of the trial itself. So in today's video, I want to explore the type of patients who might consider enrolling in a clinical trial, particularly in the context of cancer care and the philosophical implications of such a decision. So the first patient I classify as actually the newly diagnosed patient. So for a patient who's just been diagnosed with cancer, enrolling in a clinical trial appears as both an opportunity and a daunting prospect. On one hand, novel therapies can offer hope where conventional treatment might not suffice. So these patients often experience high levels of emotional distress, characterized by uncertainty about the future and an anxiety over their prognosis. A clinical trial, especially those related to new drug treatments such as novel antibody drug conjugates, or a pioneering approach like histotripsy for malignant or metastatic liver tumors, can provide a sense of hope and opportunity to be at the forefront of medical innovation. However, there are significant philosophical and ethical considerations at play. The exploratory nature of early phase trials, such as phase 1 trials, primarily assess safety rather than efficacy. In other words, do they work? And this might not align with the urgent need for effective treatment in the newly diagnosed patients. This philosophical question arises: is it justifiable for a patient in need of immediate care to participate in a trial that may not provide the benefit they are seeking? The choice of a newly diagnosed patient to enroll can be viewed through the lens of existential questions of hope, agency, and the quest for transformative experiences in moments of crisis. Okay, next is the patient with no available treatments. So in these patients, conversely, who have exhausted all conventional treatment options, they face a different existential dilemma. Usually these patients are grappling with a terminal diagnosis or have experienced disease progression after multiple therapies. For them, enrolling in a clinical trial may represent their last opportunity for intervention. Their situation can evoke poignant philosophical themes surrounding the concepts of dignity, desperation, and the autonomy of making profoundly important personal choices. In this context, phase 2 and 3 clinical trials become relevant consideration. So what is a phase 2 trial? Well, they typically assess effectiveness or efficacy and further evaluate safety in a larger group, ideally offering the prospect of better outcomes. Phase 3 trials, which compare a new treatment with the standard of care, often provide a more balanced view of potential benefits versus risks. Yet for patients at the end of traditional treatment options, the distinction between phases often loses relevance, obviously. The mere act, though, of participating may offer emotional solace and a semblance of control amidst the uncertainty of a terminal illness. The final patient I want to talk about is the rare cancer patient. So in other words, you have a rare cancer. Well, these type of patients face a particularly unique set of challenges. Due to limited treatment options and lack of extensive research, these patients find that traditional routes are insufficient. For them, clinical trials may offer the only viable pathway towards receiving any innovative treatments, specifically targeting their type of cancer. The philosophical implications are particularly rich here, reflecting on the nature of medical advancement and societal obligations towards those suffering under the burden of necessity. Participating in clinical trials designed for rare cancers can also evoke feelings of being a pioneer or contributor to medical knowledge. The rich philosophical themes of altruism Shared humanity and the quest for knowledge underscores their decision to enroll, resulting in a question of whether one's willingness to take risks can benefit both the person who has the cancer and society at large. So what do we learn today? Well, I'll summarize it. In the decision for any patient, whether newly diagnosed, at the end of conventional options, or facing a rare cancer, to enroll in a clinical trial is marked by an intricate web of ethical and philosophical challenges. The patient must weigh the promise of hope against the uncertainties inherent in experimental treatments, all while considering their own desires for dignity, agency, and meaning. Ultimately, the question of which type of patient should consider enrolling in a clinical trial cannot be answered universally. Each situation presents its own unique challenges and potential rewards. What emerges is a nuanced portrait of a patient participation informed by individual circumstances, ethical considerations, and the overarching human quest for knowledge and healing in the face of life's most formidable adversities. So with that, I hope you learned something today. I know it's kind of deep, but it's important that you think about these things. My personal opinion is that somebody who's newly diagnosed with a cancer and there is a standard of care and a treatment that works, you should not go on a clinical trial. But that's obviously my personal opinion. So with that, I hope you learned something today. Everybody's having a great weekend, and I really appreciate you listening, and thank you for your support. Have a great day.